singer KK's death, reportedly from a heart attack, or what is known in medical terms as myocardial infraction, at the age of 53, has left the entire nation in shock. He complained of uneasiness, as we showed visuals earlier, during a concert in Kolkata, but performed till the end of the event. But with a majority of Indians unaware that they are hypertensive and prone to strokes or heart attacks, it is imperative to know about warning signs, symptoms, as well as preventive treatments. Now, for further clarity on the matter and to better understand the warning signs, Apollo Hospital's Joint Managing Director Sangeeta Reddy joins us live on the broadcast. She is a global healthcare influencer and a healthcare technocrat. Thank you so much, Dr. Reddy, for sparing time for us. Let's begin with the basics. What are some aggravating factors as far as heart attacks are concerned?
Good afternoon, and let me first thank you for highlighting something which is extremely important. It is a sad but very true fact that non-communicable disease, of which heart attack is one of the largest, or the cardiac is one of the largest, is the biggest killer in India today. And so it's important for us to know what causes it and what we can do about it. So in heart disease, there are what is called the modifiable risk factors and the non-modifiable. The non-modifiable is like the genetic makeup, so you can't change that. But the modifiable is clearly your blood pressure or hypertension if you have it, it's diabetes, it is weight, it's stress, and all other lifestyle related. So the ability to control this and have a healthy lifestyle greatly brings down your risk. But also being fit is not necessarily being healthy, and therefore it's important to understand these factors, do some risk predictions, and get into deeper in terms of the science and the medicine of what your health status is. But also to recognize the signs. Like you rightly said, you were saying that he felt discomfort, he thought it was gastritis, he didn't go to a doctor, he continued the performance. So our request to everyone, and doctors see this every day, is that people do not ignore the signs and move quickly, because time is muscle and we can save lives if they come in time.
Right, Dr. Reddy. Are all heart attacks MI? And for those who may not be familiar with the term, MI stands for myocardial infraction, or are there any other subsets?
So there are multiple, but heart attacks or myocardial infarction, which is one of the most common, is when the blood vessel gets occluded or blocked. And this is because, over a period of time, plaque is building up. And then one final bit of a clot or the plaque blocks the vessel entirely. This stops the blood supply to the muscle. The muscle starts dying, and that's what causes the acute pain. So that's the history of the methodology of the way heart attacks occur.
Right. Also, how much does family history predispose you to a heart attack?
So there is a clear correlation between family history, but you can jump your genetics or fight your genetics by taking control of what are the modifiable risk factors, which is, like I mentioned earlier, your blood pressure, and make sure you have no hypertension, your weight, keep weight within the ideal range. In fact, it's very famously said by a cardiologist that kitni itni choti kamar utni lambi umar. So, your waistline is related to your lifeline. And of course, diabetes, and like I said, stress, current lifestyles. And the other big one is smoking. So nicotine is a big killer because it causes a constriction in the airflow, and airflow therefore reduces oxygen and therefore damages the muscle. So these are the 4 big factors that need to be controlled.
Right, thank you so much for that very apt analogy there about the kamar. But just moving on, what are silent heart attacks? And why do some people survive silent heart attacks and some others don't?
So a silent heart attack is one that happens when there is no symptom, no acute pain, no warning signs. There is a clear correlation between diabetics and silent heart attacks because the vessels have over the years got silently damaged, and therefore they don't show up so much. I must profess that I'm not a medical doctor, so I'm not the perfect one to be giving this to you, but as a layperson, this is information that everyone should know. And so diabetics should be extra careful, understand their risks, go through their annual checkups. And I must say also that there is a range of now some great diagnostics happening. The calcium scorer, which is like a CT scan but has the calcium score, is able to pick up occlusion in the vessels. So without an invasive angiogram, you can understand what your cardiac risk is going to be. So there's a lot that can happen with a health check, and I think it's very important for everyone over the age of 40 to start having their health checkups.
Right, health checkups being imperative post 40, as Dr. Reddy has just said. But like you mentioned, several lifestyle factors, as you just pointed out, smoking, for example, they're said to be responsible behind the growing cases of heart attacks recently. Cases of heart attacks are being seen more in the younger population these days. Would you agree that that's a fair assessment?
So absolutely. And, there are enough studies, but not entirely conclusive on the correlation between MIs, heart attacks, and COVID.
Right.
Now, all of us know that COVID is a pro-inflammatory situation, and inflammation can throw up clots. Another very proven study is for the 40-day lockdown period, young MIs reduced drastically. And what did this mean? I mean, typically, youngsters were staying at home. Many of them smoked less because if they were staying with families, they probably didn't smoke as much in front of the whole family. They drank less because, they were not out with friends as much, and the pollution was significantly less. This combination showed a very acute drop in MIs. So it shows that it is possible if we control the environment. And the converse, unfortunately, happened is that post-COVID and, when life began to come back to normal as it is now, we're seeing an upward trend. So the combination of the inflammatory effect of COVID and all these risk factors coming back, some of them heightened even more because, some people lost their jobs, the tension about living was more. So the number of heart attacks has been on a significant rise right now, especially in young India. And therefore, doctors are modifying their recommendations to say that first do a screening even from the age of 30. And if you have diabetes or hypertension, then go for a complete health checkup, even if you're in the age of 30s, because unfortunately, India has a very high incidence. So 30% of our adult population living in urban environments are known to have diabetes or hypertension.
Very worrying stat there.
And in the age of from 30 to 45, this number is at least half, so about 15% of that young age group also has either diabetes or hypertension. So there's a lot to be done, much to be done on screening and much to be done on awareness building. So I have just one, very, very important thought. And that is, India has taken things which are very important to the country every decade. So if you take the 2000s, India was pro-education. 2010 onwards, that decade, we were pro-digital. It was IT everywhere and digital. Can we somehow take the 2020s onward and make this decade pro-health? Let's stay focused on staying healthy and being fit because we don't want to see young families robbed of their dear ones.
Absolutely endorse that 100%. Let's talk about uneasiness, Sangeeta Reddy. It's been reported as one of the most common signs of heart attacks. We saw KK's video also of him feeling uneasy. He was sweating profusely on the night of his concert in Kolkata. Now, these signs like uneasiness or excessive sweating could be easy to ignore for some people. People often misunderstand it to be the reason behind some other ailment and delay calling a doctor. What do you recommend? When is the right time to call the doctor? Pick up the phone and say, we have a problem.
So clearly uneasiness in the chest area, the shoulder, the right shoulder, sometimes even a toothache on one side, a shooting pain down the arm, acute pain in the stomach, that whole region is something, if it's significant discomfort or sweating, the shooting pain, all these are very important signs and should not be ignored.
Right. Also, other health experts have said that the summer heat causes heart attacks. Do you agree with that?
So I do not know of any data correlating to the summer heat. In fact, I have seen data related to the winter cold, because the cold causes constriction and therefore more heart attacks. Hospitals typically see more MIs on winter nights. But this summer heat may be related to, the number of COVID patients, and therefore maybe changing the statistics of the seasonal occurrence of MIs.
Right, Dr. Sangeeta Reddy, just as we wrap up, let's talk about the preventive cardiology checklist. What is it that one should look out for?
So, as I said earlier, it's very important to look at your hypertension. If you're a smoker, I'm saying don't even look at it. Please just stop immediately. There is nothing more important than stopping smoking. Diabetes. So if you're a diabetic, please control your sugars immediately and work towards bringing down your sugars. Excess weight is definitely a contributory factor, so losing weight is critical. Reducing stress, finding methodologies, whether it's meditation, yoga, things that you love, laughing, things like that definitely have a positive impact on the health. So these 4 are clearly the checklist.
Right, Sangeeta Reddy, thank you so
and
much for
then finally, I do want to add that it's genetic factors, and to remember that anyone in the 3 to 6 months post-COVID isn't in a vulnerable state. They are, markers, whether it's D-dimer or the high sensitivity CRP. Talk to your doctor, understand this. It's worth being health aware.
Right, Sangeeta Reddy, thank you so much for providing us all that insight. We're better understanding MI and all the ramifications associated with heart attacks and cardiac issues. Thank you so much for investing your time with us and for sparing time for NDTV. Thank you.
Stay healthy, everyone. Namaste.